I have scoliosis.
I have scoliosis.
I have scoliosis.
I have scoliosis.
And so do I.
I have scoliosis too, which means my spine is curved. My ballet teacher noticed that my back looked different, so I went to see a doctor.
Scoliosis is as common as asthma in girls. Boys get it too, but less often. It usually doesn't hurt, but it can.
It's not a disease. It's a condition, and no one really knows why we get it. My mom doesn't have it, but it tends to be more common in brothers and sisters. Kids with scoliosis can be active. They can usually play sports. I love to do ballet. Scoliosis is nothing to hide or to be embarrassed about.
If you have it, just embrace it, and no one would really treat you differently for having it. If anything, people are more supportive.
You shouldn't be embarrassed because other people have it and you're not the only one with it.
A normal spine looks like this. Scoliosis is a condition that curves your spine, like this. If you ignore it, it usually just gets worse. An extreme curve can hurt, and it can even affect internal organs like your heart.
The symptoms of scoliosis are pretty easy to see. You can ask your doctor to check your spine at your next appointment, or you can get a parent, a friend, or a coach to have a look.
When you bend over, with your feet together, it's pretty easy to see the curve. That's something you need to tell your family doctor.
You can also see that your pelvis is a little bit...
Sometimes you can just look at how someone is standing to see the possible symptoms.
You can get someone to look for the unevenness in your hips and shoulders.
I'm just going to look at your shoulders.
That's a warning sign your doctor needs to know about.
Your hips.
Your back should be checked at least once a year. So what will happen if you do have scoliosis? Sometimes, when the scoliosis isn't too bad, doctors just keep checking to see how you're doing.
I say people wearing a brace is like when your teeth are crooked, you get braces. Well, your spine is crooked and you wear a brace.
They're specially made to fit your body. They take a while to get used to, but it's not too bad. And some kids even get them custom painted. They're pretty easy to take off and to put on. Braces stop scoliosis from getting worse in up to 92% of cases. Exercise really helped me, but not just any exercise. There are specific exercises to help people with scoliosis. And in some cases, especially if you ignore it, doctors may decide to operate. Surgery can lessen the curve and stop it from getting worse.
Thousands of us have scoliosis. If you think you may have scoliosis, go see your doctor. The faster you deal with it, the better. Remember, you're not alone. Check out our website. We've got your back.